I think we'll just give it one more minute and then we'll start. It's great to see so many people on the screen. Okay, so I think we will get started. Welcome everyone to our Yom Kippur Social Justice Hour. I am Paula Xanthopoulou, Chair of the Dorothy Sirota Social Justice Committee at Temple Israel. Social justice is the unifying mandate of Reform Judaism, central to who we are and what we do in contributing to Tikkun Olam, repairing the world through direct service, tzedakah, and advocacy. That is our mission. Today, on this very special day of contemplation, when we're thinking about teshuvah, tzedakah, and fasting, we dedicate this hour to the millions of people in this country and around the world who are suffering from food insecurity and hunger. Not just one day a year, but every day. We'll have a chance to talk a little bit more about that at the end of our program, but now to welcome our very special guest, longtime Temple member, Dr. Barth Green. Dr. Green is the Executive Dean for Global Health and Community Service at the University of Miami Health System. Having served for many years as chairman of the Department of Neurological Surgery at the Miller School of Medicine, Dr. Green is a world-renowned specialist in the surgical management of complex spine and spinal cord injuries and disorders. He served 37 years in the U.S. Army Reserve Medical Corps, where he reached the rank of Lieutenant Colonel, and recently retired from his surgical practice. Dr. Green is co-founder of the Miami Project to Cure Paralysis, Shake a Leg Miami, and Project Medishare for Haiti, and has received numerous local, national, and international honors and awards for his community service and humanitarian work, including the Rabbi Joseph R. Narrett Award for Community Service. It should be duly noted also that his daughter Jenna Green is the longtime co-chair, along with Susie Sponder, of our beautiful Chapman Partnership Christmas Eve Mitzvah Project. We are very grateful and humbled to have you with us, Dr. Green, today to educate us and inspire us. Not just because you're a pretty big deal in this town, but also because, and perhaps more importantly, you are a member of our Temple Israel family, and today we have a very unique opportunity to learn much more about you. So, Dr. Green, you're on.
It's a great privilege and pleasure to be here, and I'm excited to be able to share my life's journey, and hopefully in a rapid fashion, so we have time for questions and answers at the end of this session. But I think it's important to realize we are who we are because of who preceded us in our lives and who is following our pathways in our family and moving forward. And my family is a lot more than my children and grandchildren, but of course my family at work and at the temple and my community and globally. So I'm very blessed to be here today. To me, the true sign of someone's religion and their faith is how they behave every day of their life. Not one day a week or 2 days a week, but how they treat others, the type of respect and the type of attention they pay to not just their own needs, but those of the people around them, locally and globally. And that's to me a religious person. And I'd like to quickly go through my experience in social justice and religion and my journey in academics and global health and disasters, and get back then to the opportunity to answer questions about my life and my perceptions and recommendations to others. I started out being born in a Navy hospital during World War II. My dad was in the Pacific on an aircraft carrier as a physician. And ironically, my wife, Kathy Green, her father was also next to him. They didn't know each other on another aircraft carrier. And it's a small world of ironies. My father was born to uh, Jacob and Hannah Green, who were from Russia. And they came over in the early 1900s seeking liberty and democracy and opportunity, like so many Jews who were fleeing the Tsar. And we actually got the name Green because a neighbor adopted my great great grandfather because the Tsar was taking all the male children to war and they were never seen again. That's how we ended up with the name Green. And my other grandparents, Hyman and Julia Yanovsky, were also from Russia, and they came over at about the same time. And Hyman became a physician, the doctor from the union who sponsors medical school, and a family practitioner who never owned a car, took a bus, and when he passed away, had nothing except love for his patients. And my grandmother's wife was quite an aggressive libertarian and socialist who believed in equalities and everything in life and debated and some of the leading intellectuals in that time. And her sister was a very renowned Yiddish poet, so, and another a Ziegfeld dancer. So I have quite an interesting heritage. My father went to medical school. He was very smart and got in the top medical school in Illinois at Northwestern. And when he finished his first year, the dean called him in the office and said, "Dr. Green, you've got straight A's, but I advise you to leave our school." And my father looked at him and was kind of confused. And he said, "Why?" And he said, "Because you're Jewish. And the chances of you graduating from Northwestern University and finding an opportunity to train are almost nil. And I really believe you'd be best served going into the public health education system as quickly as you can. And I'll recommend you and I'll make sure you land a good place in the class." My father was very shocked, but he listened to the dean and enrolled in University of Illinois and finished again at the top of his class. But that had a real impact on his way of thinking of the reality of who he was, where he was from, and what it meant to be a Jew in the 40s in Chicago. At the same time, my mother was attending University of Illinois in education, and they met and fell in love and got married. And she went off to be a school teacher and a social activist. She was a hippie, University of Chicago graduate student who marched with Martin Luther King, and people, the Nazi parties would march down my block on the south side of Chicago, and she'd be out there with a hose spraying them down. And she would, our windows would be broken, crosses would be burned in our front yard. And that's how I grew up. I just thought that was part of life. And when I got to college, I learned that Kike wasn't a nice name. I was told at that time that's not what people should call you. But I had a very unusual background in that area. At the same time, my father integrated several hospitals, brought Black physicians onto the staff at great cost to himself as far as his popularity, but he was in the same thought that my mother was about social justice. And we were there, obviously, when Martin Luther King marched and my mother attacked the Nazi parties, and she'd get detained by the police, and I did for other reasons that weren't as nice, like being out after curfew or something, drinking a beer at age 16. But anyway, that's how where I was from and how I grew up. I went away to college, and I graduated high school in mid 63, went to Indiana. And because of my behavior, I was invited out of my house and lived in the YMCA in Gary, Indiana, which was quite an experience for a couple of years. And that sort of made me also realize and appreciate many things in life and what's important. And during that time in Indiana, I also got to involve with a bunch of surfers from Hawaii who used to go out to the West Coast. So I was actually there during the Watts riots, and not just the Chicago riots, but the Watts riots, and had quite an extraordinary experience during that time in California. And social justice was always in my genes at the time, and my family's. And I went on to medical school in 1966, and I entered Indiana University and began my journey, which led to neurosurgery. And during that same time, I was able to, be inspired by an extraordinary, socially conscious, wonderful Jewish neurosurgeon who became a world leader in education. And he inspired me to become a neurosurgeon, as did my job working in a laboratory with paralyzed veterans who would come in the morning. I'd be exhausted from partying all night, and they'd spent the last 6 hours getting lifted out of bed into their wheelchair, showered, shaved, cleaned up, and then come to the lab with a smile on their face. And I was grumbling about my life, and they were so happy to be contributing toward a cure to paralysis. And that's when I decided that one of the points in my life that would be a focus, a dedication, would be to creating a cure for paralysis. And so this was the beginning of that program at that time. So during that same period, I also was very fortunate to make some wonderful friends across the United States and be involved in a lot of very interesting ventures, including the launch of Gatorade, where I helped them gather funds because I was always hustling, selling pizzas, waiting tables to pay my tuition at the time, since my father hadn't quite forgiven me for my earlier behavior, which he later did, and we became best friends. But it's important to know that life is a journey, and there's all kinds of ups and downs and lessons. And the most important thing to do is to remember, that life is a lesson, and not to keep making the same mistakes. And that was very important to me. As I became a neurosurgeon, I went to Detroit for a year of surgical training. I was involved in the post-riot era there, and the same obvious racial injustice, inequities, and very violent society existed. But I loved my time there because it was extremely exciting, and I got to meet so many wonderful global people that were from other countries that really didn't have opportunities, and they sought them in the United States, and they sought them at Henry Ford Hospital in Detroit. I ended up going to Northwestern University, ironically, where my father was sort of booted out of, to become a resident and complete my training. My first day there, I met my amazing wife on an elevator, and that was in 1970, and that changed my life. And we're still together and working as a team today, which is a real blessing for myself and I believe the rest of the world that I've touched. Nothing's been touched without her input, support, and her spiritualism. So that's an important part of my life. During that time, I began my global health journeys, and I went to South America, did a lot of volunteer surgery in Ecuador, Guayaquil, and Quito, and Colombia, Bogota, and Cali. And I had the wonderful experience of being kidnapped by the Cali cartel in 1980 when I was lecturing in Cali. One of the cartel leaders from Medellin was shot, paralyzed. He saw my picture in the paper and decided to make an appointment. So they put a gun in my mouth and put me in the trunk of a car and took me to his headquarters. And that was the beginning of another long story, which I'm not going to go into. But the same year were the McDuffie riots in Miami. And I had another extraordinary experience living close to the hospital, to Jackson, which was an amazing institution where there was one level of care for everybody. Didn't matter where you were from, how rich, how poor, what your assets were, you were treated like family. That's the only place in the world I could work and still work. It's an amazing place. But anyway, I was driving in because they told me there was a massive amount of casualties from the first day, and they had a lot of head injuries. So I jumped in my car, which was a used Hertz four-door Caprice with I don't know how many 100,000 miles on it, looked like an ambulance. And I pulled into the front door and lowered my window to say I was a doctor. And I got dragged out of the car and beaten pretty good. And luckily, the security guards came out and dragged me in. And I did 15 operations all night with the residents. And then, they were all crushed skulls, all the cases. And the next day, I went home a few miles away and got called back because of the backlash that occurred and the new rash of violence from the other side as a repercussion to the violence from the Black community. So it was really an unusual experience and part of my life. So that was how I started out the 80s. And I had the privilege to be the doctor of a lot of the people you see on Miami Vice in the movies because of the fact that I worked with a lot of people that had gunshot wounds and back and neck problems and neurological problems. I ended up getting to know a lot of these people. And so when I watch some of these shows on TV about that period of time, I recognize far too many people. But the good news is I stayed as a professor with my integrity. And during those times, Temple Israel was so important because they brought my children up with me and my wife into the world with their bar and bas mitzvahs and school, Hebrew school, and Sunday school. And my daughter got involved in teaching and a lot of the social justice programs. And so my children were raised with that Temple Israel culture. It was an amazing institution because it was in the middle of the hood where I worked at Jackson. I lived close by, and it was, a block away. There were cars being sold for $1 million. And in that neighborhood, people had nothing to eat. And Temple Israel had a full-time commitment to make sure that there was healthcare equity and social justice. So that's why I'm so spiritually tied to Temple Israel. And even today, I'm so honored and privileged to be here to discuss it. In the 1990s, I became Dean of Global Health at the university. And I spent 22 years being chairman of neurosurgery. Our department was the top in the world. In 1985, Mark Bonacani was paralyzed, and my dreams to have a major project and cure paralysis became more real when Nick Bonacani brought his son there, and we joined hands and created the Miami Project and Bonacani Fund. And today it's the largest neuroscience center in the country and considered one of the best in the world. Not just spinal injury, but brain injury, stroke, MS, ALS, all the neurological disorders. The focus is to repair the nervous system. And it's an extraordinary group. Another experience occurred about the same time in 90 when Harry Horgan came to my attention. He was a paraplegic with a sailing program for disabled in Rhode Island. And I said, why would you be up there for 2 months of the year when you can have 12 months? So thanks to Jay Weiss, an amazing human being and a symbol of what's right about Judaism and social justice, we brought Harry down here. We got a bayfront place in Coconut Grove, and we spent the next decades keeping all the buildings from overwhelming that facility. And today they treat thousands of disabled and challenged kids and adults with physical, financial, and developmental challenges. And they just even the playing field using the waters of Biscayne Bay. So that's another extraordinary opportunity. And in my global health, I became in charge of disaster responses after the historic earthquake killed 300,000 people in 1 hour in Haiti. And we mobilized a field hospital, University of Miami and Jackson Health System, and we treated 30,000 people in 4 months and brought in 5,000 volunteers and did an extraordinary job. And I remember coming back, having an open heart surgery, and my daughter dragging me to Washington to testify about how the Red Cross, all the different monies never got to Haiti, not just the Red Cross. They helped us a lot, but a lot of money ended up in the Beltway Bandits. And a day later, I was audited personally, and so was Project Medishare. And but anyway, it was an interesting time, and I thank my daughter for that too. She pushed me up to testify 1 week post-op with wires in my chest, but that was part of this journey too. But it's very important to realize what I learned from a very famous philanthropist, John Batchelor. The past is history, the future a mystery. Each day is a gift. That's why we call it the present. And that's the most important thing, because the world doesn't have an even playing field. I mean, we're sitting today in the middle of the worst pandemics, epidemics. You know, world hunger is at an all-time high, and it's just extraordinary. COVID, you know, cholera. The United Nations rescued Haiti, but they brought cholera, which almost destroyed the country. And thousands of kids were raped, orphans were created, and nobody ever said, I'm going to take responsibility. So there's so much misjustice that needs to be made correct, so much government corruption that needs to be corrected. And I'm not just saying, you know, in Haiti, globally, it's around the world. So working in disaster relief, you have to work with governments and always under the respect of their laws and the guidance of the ministers of health. But healthcare inequity is unbelievable and intolerable. An example, Haiti has 11 million people and one neurosurgeon who they just took from us. He's now the prime minister. So I have one resident taking care of 11 million people with brain injuries, tumors, and everything else. And I can't bring volunteers there right now because of the gangs. So there's a lot of challenges. In the Bahamas, a lot of governmental challenges. You know, we have a big relief program in the Abacos. But the most important thing is the people of these islands, of these nations, of India with their tremendous COVID hits. All these people are wonderful people. So you have to erase the politics, the religion, the government, and focus on how you can give one thing to the people: opportunity. What does that mean? It means jobs, not entitlement, not paychecks for nothing. It means opportunities to work and support themselves. It means food. It means the opportunity for education, you know, for infrastructure, clean water, sanitation, clean air. These don't exist in any developing nations. There's no sustainable healthcare systems. So this is what I'm focused on, and with a lot of support from Temple Israel, from my community, from my university, from the Jackson Health System, and this is where we're making tremendous strides. Our dean is Haitian American. He's brilliant, credentials, Harvard, Princeton, the best of the best. And he cares about social justice. He cares about gender equality. He cares about all of these issues. So working in a medical school with a guy like that is just a dream come true. So these are the opportunities we have. And so I just want to share with you that I am fired up. I'm 76 and a half, and I just feel like I've got a lot to do every day when I wake up, and how grateful I am to everybody for that opportunity. And just a little word on food inequity. One of the big programs of Project Medishare is in the Central Plateau, the most isolated rural area of Haiti. We have school feeding programs. And the most stark example is we feed thousands of children every year at school. They get one meal at school. If you take the siblings in the same family and you put an 8-year-old next to an 11-year-old, and that 8-year-old's in our school feeding program, they're a foot taller and much more stocky and strong than their sibling who's 3 years older. 2 kids, same genetics, same house, one has nutrition. How does that break your heart? So we have a lot of work to do. We have a lot of people to feed, and I support the World Food Bank. All of these programs are great, and I'm just so proud to be part of Temple Israel and their commitment to this evening the playing field. That's what life is all about. I have no idea about my time.
You're good. That was pretty quick. So now we do have time for questions. If anybody has a question of Dr. Green about his life, about his projects.
Hi, Dr. Green.
Yes.
Can you hear me?
Yes.
Oh, hi. My name's Elaine Lidvack. You might remember my husband. I want to thank you for your skilled hands. You kept him walking for 30 years because of the wonderful surgery that you performed on him around 1982 or 3. I forget. But anyways, your life story is just amazing. Is there any problem with getting the food to the people up in the regions you're talking about? Because I've heard there's so many gangs there, and how do they do it so that they get this? And what can we? I'm on the Social Justice Committee. What more would you like from us?
Well, I think it's up to projects like MediShare for Haiti, who works with the University of Miami, the Center for Haitian Studies, and Jackson Health System. So what we do is we have caravans of trucks. We have the private sector in Haiti, the new generation of the 2%ers. Every developing nation has a couple percent of the business sector and 98% who are in severe poverty. And that's the way developing nations are around the world. There's a little difference, but Haiti, 2% of their budget goes to healthcare. It's really an embarrassment. But as far as feeding, what we've been able to do is to create partnerships with Farmers Alliance and other groups that actually create opportunities for people to grow their own food. And the worst thing we did in America, for example, is President Clinton. You don't blame him, he meant well. But when he was president, they brought in, literally hundreds of thousands of tons of rice. And what that did was it put the rice farmers in Haiti out of business because it was free. When I came with the earthquake, I gave treatment to 30,000 Haitians. What did that do? I put all the doctors, nurses, and pharmacists out of business. And at some point we learn. So what MediShare is doing today, and with a lot of support from my wife, my children, Temple, everything, our community, what MediShare is accomplishing is we're buying food from Haitians. So not only are we bringing medicines that aren't available there and technical equipment and supplies for surgery, fractures, that type of thing, but we are trying to buy at any cost food from local farmers so that we're building capacity. We're not just doing what we did before, bankrupting that sector of the economy. So that's where we've learned our lessons. I remember my daughter was driving up a mountain with me when she was 13 or 12 in Haiti, and she was scrubbing kids with scabies every day, and she was driving up the mountain, and she loved the Haitian kids, and she had these big bags of candy. We were at the top of this big mountain, and there was a dozen kids with these huge bulbs of water, these big pots of water at the very top, and she threw the candy out the window, they all dropped the pots, the water disappeared, the pots broke, and they had candy, but they had to walk back down the mountain. That's what we learn. You learn those lessons in global health. And so now we're doing much better. So the gangs are there, and we've learned how to get around them, and you just have to deal with it. And we hope someday there'll be a real elected government there, and democracy and civil order, the justice system. But it's going to take other nations to help, like the United States. The U.S. came in for a week, and then they were gone. You know, I'm talking about Southcom, and when they left, the gangs came in. But the important thing is, I always feel optimistic because the people are amazing. Haiti, the Bahamas, India, you name it. Jamaica has a huge shortage now in oxygen. You know, people are dying. Cuba, oh my God. In Cuba now, people are dying like crazy with COVID, and we don't know how many because they don't report it. And we need to help those people, not the government. We need to help people's healthcare needs and nutritional needs.
You have a question in the chat from Ben Cuney. His comment and question: thank you for your inspirational leadership, Dr. Green. Do you believe the medical students of today are as invested in community improvement and medical justice equity? Who are the leaders to locally propelling involvement? What can TI do to help?
Actually, the reason, if you do we did surveys of the medical students that come to and one of the major reasons they come is for social justice, global health, and healthcare inequities. So very few medical schools have a huge public health system they're affiliated with, where there's one level of care. And so there's so many great groups at The docs do clinics in the immigrant camps, you know, and we do free clinics all over the state. We collaborate with other groups. So I never remember a more socially focused group of students coming in. As a matter of fact, they flood my phone, my office, with, can I help? How can I help? How can I be involved? As we speak right now, there's a big crowd of students in my headquarters office working on grants and working on relief efforts. And they're doing it on their own time. They're not getting paid for it. So I think I'm optimistic. You know, but the healthcare system is based on dollars and cents. You know, that's the problem, not social justice, not healthcare equity. So we need to get that turned around too. There has to be equal healthcare for everybody in this nation. My gosh, we've got so much going for us. So hopefully that'll happen. And it doesn't mean the private sector won't always be important. My son is a leading dermatologist worldwide in the private sector, but he donates a lot of his income to this type issue, social justice, and foundations. And he teaches voluntarily at Jackson Hospital in the medical school. And the same with my other son, a pediatric interventionist. They're into social justice. So they are, you know, I'm really surrounded by wonderful people with my family beyond. But if you ask me about the new generation of young doctors, all they're asking you as the community is, how can we help you? How can we leave the medical school, get out on the streets, get out in the communities, and make a difference? And it's up to Temple Israel, for example, to create the programs that they're historically famous for. You know, Temple Israel is always aligned with minorities. They've always aligned with the different church groups. And that's what's always made me so proud to be a member.
Thank you so much. Yeah, well, we hear that loud and clear, Dr. Green. And certainly if you or any of your student groups has a need for volunteers, unskilled volunteers, please give us a shout out, because we would certainly like to help in addition to creating our own programs. I see another question here from Diane Lindner. I wonder if Dr. Green could talk about what happens developmentally and neurologically to a young child who doesn't have enough to eat.
Well, they are, yes, that's a simple answer. Their appearance reflects their brain, their heart, their lungs, their kidneys. You can imagine if right now there's no water in the south of Haiti. So we're shipping all of these, there's no clean water, there's no plumbing, no infrastructure. So we're shipping these tablets to purify the water. Hundreds of thousands of them are going out, and we're sending, there's no, you can imagine not having water to drink. Oh, that's a real problem in developing nations, and it's compounded in disasters. And there's no nation in the world that's not affected by disasters today because of global warming, hurricanes, tornadoes, earthquakes, fires. I mean, every place in the world is affected, and we need to recognize this, and we need to say, stop. Let's change our modus operandi, and let's look at the right type of fuels, the right type of vehicles, the right type of eating, everything. So this is a time to really turn things around. As they say in the business world, we need a turnaround. I don't know if that's the right word, but.
We have another question here from Ben Cuny. Dr. Green, is the leadership of President Dr. Frank stimulating public health education opportunities and leadership in our South Florida community?
I think he's an extraordinarily passionate public health official, has a history of being Minister of Health and Dean of Public Health in Harvard, and Mexico's Minister of Health, Colombia's. He's got a great heritage. And yes, every day of his life, he's committed to the students and stuff. But it's a challenge. You can imagine being a private, even though nonprofit, university where hundreds of millions of dollars are being sent to all the public universities around us. And how do you survive as a non-part of the public health, public university system in Florida is very difficult. But he's doing his best, and he and his wife have historically and continue to be committed to social justice. And he definitely is out there among the students, among the teachers, and has a lot of hard decisions. He's great, and I can reach him, I can talk to him, and he's responsive. A lot of people question decisions, but because of all the laws and restrictions, you can't talk openly about why you make a decision today, because there's, people waiting to pounce on you if you say left or right or up or down. So the leadership of any public office or institution have tremendous restrictions. And it's not like you can go out and say what you think. Donna Shalala used to do that. She would always go out and she'd jump on a plane and go to the jungles in Haiti with me. And it didn't matter, it was Aristide's helicopter, which he didn't know. But the point is, things are a lot different, fast forward 15 years. But I do think he's a good person, and his wife are good people, and they really care about the students, about education, about the university. But there's no doubt that the politics and the legal ramifications for what you say. I've never been good at keeping my mouth shut, but anyway, that's why I'm, where I am today, still with a lot of plaques and medals, but not anyplace else. But you know what? It's all good. I just think that being at a university that cares about bringing in the next generation of leaders and doers and successful people with a lot of diversity. I mean, our medical school is so focused on social justice and getting rid of misogyny and working on opportunities for everybody, no matter what your beliefs, what your race, what your religion. It's really a pleasure to have that environment and be in a public hospital where people come in all the time and they say, do you have insurance? And they say, what's that? You know, and they still get taken care of. They don't get turned away. So this is why I get up every morning and say, wow.
That's amazing. That's so beautiful, Dr. Green. I have another question here from Jacqueline, who asks, how does your organization tie into other organizations' efforts such as Rotary?
No, there isn't an organization we don't work with. You know, Rotary and United Way, and we launched the Maven Project, which is a national free tele consults for unfunded patients around the country with the help of Hard Mogul at the time, United Way. But we're doing all these things cooperatively. We work with somebody called Direct Relief International, a big disaster, group. I mean, the Haitian Medical Association nationally, and Nurses Association and Center for Haitian Studies here, they all join hand with us in Haiti, for example. In the Bahamas, we have local groups. The CEO of one of the major hospitals here is from the Abacos. So we've got great connections to help people. But there's definitely, an hour from here, people are starving to death and they don't have vaccines. And, it's just, But the bottom line is there's answers to all the challenges, there's opportunities, and it's up to us to make sure every day of our life we do a mitzvah. And that's what my mother, and my father instilled in me, that every day is an important day. And I really believe that we have that responsibility to think about someone else every day of our lives, and that changes the world. And people say, well, what can one person do? That's baloney. Every one of us, by touching other people, can do amazing stuff.
Thank you so much for those remarkable and inspiring words, Dr. Green. There are a few things that you mentioned that I think we as the Social Justice Committee can pick up on. And as you know, we're celebrating our 100th anniversary, which means we're going back to delve into social justice for the past 100 years, see where we measure up to all of that, and see how we can go forward and what we need to go forward so that we can measure up to some of the things that have happened in the past 100 years. Now we're going to go local just a little bit to talk about some programs. Last February, the Social Justice Committee made a commitment to fight food insecurity and hunger by establishing a food drive to be continued indefinitely. And it's now in its 8th month. Indeed, and for sure, there are many issues that concern us. Immigration, voter rights, hate crimes, underappreciation of our farm workers, gender equity, homelessness. We have engaged in all of those, and we will continue to do so. So please check our website, our pages on our website, templeisrael.net. But having said that, food is the most basic of needs. Now that we are fasting and we have just a small taste of what it's like to be hungry, let's ask ourselves, how does anyone excel in school? How does anyone work that second job? How does anyone sit around worrying about voting rights when they are constantly denied food, constantly denied sustenance? This is such a humongous problem, and certainly Dr. Green's comments underscore that. Horrible problems in other countries, but horrible problems in our own country. The need and the problem is enormous. Last year, 60 million Americans had to count on food banks in order to put food on the table. So that is why we feel that we have an obligation to lean even further into the issue of hunger. Now I'm going to hand it over to Mike Sagmeister, and just so you know, Michael Sagmeister is our food drive boss. So don't think that organizing, shepherding, delivering, and working on our kind of revolving food bank the way we have structured it is a small task. It's a very big task, and we thank Michael for all that he has done for our food drive and for our committee. Mike.
So thank you, Paula, first of all. I think you're way overstating how much I'm doing. But I just want to share a little bit from our flyer and just give you a quick overview of what we've been doing. Like Paula said, we've been doing this for 8 months, donating to different food drives for different organizations. And the big thing for us was really to have a focus, like Paula mentioned, on local organizations that maybe a lot of us, even in the community, might not necessarily know about. But I'm going to share a little bit from our handout here. And just with a quick overview of also what, after all this, what we talked about, what can we do, right? And of course, first of all, we can support really important organizations like Dr. Green's project with Project Medishare. There are a lot of national organizations that we can support, like Maison, for example, a great Jewish organization that works to really bridge the abundance of the Jewish community that we're lucky to have in some cases in the US, and the desperate need felt by millions of hungry people. But that focus on local organizations really comes from the fact, like Paula mentioned, if you think about 60 million people who have used the food bank last year in the US, that's roughly, when you think about, 1 in 5 people, you're not recognizing by just looking at people who's using a food bank, who's in need. You might have a coworker who's going hungry right now. There are so many people in our local community that really, really depend on food banks, that really depend on the contributions that we're doing. And that's a big, big thing that you can do. From, if you're asking yourself now, what can you do? What can you do now to help bring social justice to our community? Make contributions to our food drives. This month, a big focus is, again, our food drive for the Farm Workers Association in Florida Homestead location. This is a really, really tragic thing if you think about. Those are the people who work hard to get food on our tables, and so many of those people are going hungry right now, this moment. So that's why for the second time this year, actually, we're putting a focus on the food drive for the Florida Homestead Farm Workers Association. Couple other things that just wanted to share that we did over the past months. For example, we had the organization was Curly's House of Style, which was a very, it's a small local organization that really started from what an individual did to just wanting to help her local community in the late 80s, early 90s. And it became this ongoing food bank. They're open every day. They're open to everyone who comes. They don't ask questions. Whoever is in need is being helped by them. And really just an incredible organization. And we're incredibly happy and with the amount of food that we're able to bring to them. There's a project in Miami that has local food, openly accessible food pantries and food fridges all over places in Miami. So in the Overtown area, there's some even like Coconut Grove area, Pata, all over there. I think they have like up to 10 locations now. And we were able to supply not just once, but twice, a complete open pantry for them, which was great. And just this past month, I just really, really also want to give a shout out to Judy, who's on here as well, who's been amazing and has worked a lot with with the food pantry at MDC. They have food pantries on campus for the students that go there, because there's a huge, huge need also for the students there. And it was a great experience there, and hopefully an ongoing relationship that we can have with them as well. Because like Dr. Green said, like one of the great things at Temple Israel has always been our connection to local organizations and working together with those local organizations. I'm going to hand it back to Paula, but just want to, on this handout that we have there, up there, there's some words from Rabbi Chaim Stern of blessed memory. And the one thing that really stands out is, teach me to give thanks for what I have by sharing it with those who are in need. And I think that's a big, big thing to keep in mind, especially on a day where we're maybe more aware today what we have in our lives on the day that we're fasting, on the day where we choose to fast voluntarily. It makes us more aware of what we have usually. And really the biggest thing that we can do to show our gratitude for those blessings is to help those who are in need right now. So thank you so much. And thank you, Paula, for organizing this. And Dr. Green, I'm just in awe of everything you've been doing. Thank you so much.
By going to templeisrael.net, social justice, and hitting the little box that says Yom Kippur Social Justice Hour. And this PDF will pop up with live links so you can go investigate, which project or projects you might want to be involved in the coming days even. According to Feeding America, this is Food Action Month, and tomorrow's Food Action Against Hunger Day, September 17th. So we have an opportunity to help, to reach out in these high holy days, and to help our neighbors, because our neighbors are really in need, as Michael so aptly indicated to all of us. So, on that note, I would like to thank everyone who joined us today, and special thanks to Dr. Barth Green, who really was beyond inspirational. And we wish all of your families Shana Tova and a happy 5782, and we look forward to working with you in the coming year. Thank you, everyone.